Well, Sir Keir Starmer, as we were saying, has confirmed the government's looking at tougher rules on outdoor smoking to reduce, he says, the number of preventable deaths linked to tobacco use.
The Prime Minister said the government has got to take action to reduce the burden on the NHS.
Details are unclear, but the ban could include outdoor restaurants, outside hospitals, sports grounds, and, of course, our beloved pub gardens.
But will this ban be enough to save the NHS? Well, we're joined now by NHS GP Dr David Lloyd. What do you make of it, Doctor?
I think the effect on everybody is going to be marginal, but it is just another nail in the coffin for this dreadful, bizarre ritual that everybody has, that smoking is something that we should do for freedom. It's a horrible thing to do and has horrible health consequences. And in fact, when the smoking ban came in pubs and restaurants, there were 1,200 fewer heart attacks, I think, in the year afterwards, and a reported improvement in the health of people working in restaurants and bars. So, it's time smoking went, basically. I mean, it's a ridiculous thing to do, despite Netflix trying very, very hard to get us all to smoke. It really is something that needs to go.
Oh, well, what's the Netflix thing? What, just because there's smoking in some Netflix shows?
Yes. Did you watch Netflix? Every movie that they have commissioned, they smoke like chimneys throughout the whole thing. They must be being paid by the industry.
Well, let's say we don't know if that is the case at this stage. We've got to be very careful. We've got to be very careful what we say. It might just be the...
Well, yes, you do. I don't. So.
Yeah. Look, but what I'm intrigued by, because there is obviously you're looking at the health benefits, and let's agree, smoking is bad for you. I mean, there are no upsides to having a cigarette, but you also said the health benefits from this sort of ban are absolutely marginal. So it begs the question, why bother doing it?
I think I think we need to make smoking, very marginal activity completely. So yes, it may have marginal effects, but let's make smoking marginal.
What do you make of Sir Keir Starmer citing these figures, causing 80,000 deaths each year? This is long-term tobacco use. But there's also the issue, isn't there, of second-hand smoke. And when we're talking about pub gardens, there is a lot of second-hand smoke. Even if you're not smoking, you're exposed to it, aren't you?
Yes, I think there is. That's absolutely true. The very famous case of Japanese wives, 50 years ago. Traditionally, Japanese wives didn't smoke and their husbands did. And there is a significant death rate from passive smoking.
I mean, that's what I don't understand from this, in terms of you can understand the indoor ban on smoking because of passive smoking. Outdoors, clearly, if it has any impact at all, it's going to be absolutely minimal.
Yes, and I think you can argue that, and I think that's absolutely right. But as a part of a package of measures to make smoking a less central part of our lives, I think will be a fantastic thing.
Dr. Lloyd, good to see you. Thank you very much indeed. That's a medical argument. I mean, what else would Dr. Lloyd say? Of course it's bad for you. Of course, in that sense, you shouldn't be doing it. It's not a good thing for your health, but what about personal freedoms?
Yeah.
I'm not advocating smoking, but I do think it's about choice, isn't it?
No.
And Keir Starmer on course for a big row with the hospitality industry.
Yes, I mean, this is sort of Labour sort of go in for bans and things. That Tony Blair thought about banning hoodies and baseball caps from supermarkets. It never happened, but it was one of the things that he thought about doing. There was another plan for British Asians to be forbidden from speaking foreign languages at home. That never happened either. Now we have the smoking ban. So a new Labour government just started, and here we go.
To be fair, though, this extension of Rishi Sunak's smoking ban, right? So
yes,
the age limit on cigarettes.
Yeah, I mean, Rishi Sunak's one, which in fact Labour will bring back. Rishi Sunak's one, and the idea was that anybody born after the 1st of January 2009 will never be able to buy cigarettes. So there's a slight problem about the cut-off point. But obviously, if you were born on New Year's Eve, you would still be able to smoke. But if you were born on New Year's Day, you wouldn't. So there are sort of issues with that. Obviously, this is very different because this is banning outdoor smoking, and particularly in pubs. I mean, what it strikes me as that this should really be a decision for pub landlords. So as part of, say, the licensing application, they say how they cater for both smokers and non-smokers so they can actually drink side by side.
I mean, I wonder with this, I mean, there is room in this proposed legislation, isn't there, for smoking areas? It's just they're saying you can't do it in the pub garden.
Well, yes, I suppose you can look at it like that, but they're also saying no to smoking on pavement. So if you can't smoke in a beer garden, if you went to the front of a pub or a restaurant, you couldn't smoke there either. And it kind of begs the question, why do they want to do this, really?
Well,
they keep saying...
Deaths, really.
But it's just yet another thing. How about looking at the people that are openly smoking cannabis on the street? I'd much rather they went after those people than people smoking in a beer garden. I think...
I mean, you can't walk anywhere without smelling cannabis.
Yeah.
No, that's right. Yeah.
It's got so much worse.
Cannabis is everywhere. I mean, I think that the point that Keir Starmer was making yesterday was that it costs the Health Service £2.5 billion a year to treat smokers, so he must do something about it. I'm not sure this would actually stop people smoking, if that's the aim of it. It's
the real thin end of the wedge, though, because they're coming for cigarettes on day one. The next thing, it'll be sort of, pies, Prosecco, whatever it is you enjoy, whatever it is you like.
Touch your toenails.
Exactly. And who's going to police it as well? Are they just going to expect the poor people working behind the bar, who are busy enough as it is and probably not getting paid all that much? Are they supposed to go out there and tell people off for smoking that maybe 20, 30 years older?
You're talking about 50 years ago, 45% of adults were smoking. We're now down to less than 13%. So it is actually going in the right direction.
So even you think this is a step too far, Nigel?
Yeah, I do. I mean, I'm a smoker. I was in favour of the ban on smoking indoors. I think that the people who don't smoke have a right to breathe clean air, but then people who do smoke have a right to go and smoke somewhere else where they're not actually affecting those people.
But it's interesting. The Guardian front page says that they point to polling which shows the majority actually support this. Every demographic reportedly supports it, apart from Reform UK supporters.
Yes. Well, obviously they're smokers.
But Nigel Farage said he'd never step foot in a pub again if this comes into force.
Yeah, well, I mean, Nigel Farage likes his cigarette in a pub, for instance. There were two polls out yesterday which are quite interesting, that roughly two-thirds of people were saying, we quite like this, which sort of suggests that the British people actually quite like the nanny state.
Well, they just don't like smoking.
That's a bold statement, isn't it?
I'm just quoting the polls.
But you want to see the breakdown of those people who have said they agree with it. Are they smokers or non-smokers?
Are they people that go to a pub or not?
Are they people that go to a pub or not? And I think that you have to be really careful with a Labour government because, as I say, it's smoking at the moment, but what about, are they going to start looking at takeaway food? We're already seeing in another story about obesity, they're going to look at things like that. And it's like, OK, so be very careful what you wish for, because I do think it's the thin end of the wedge when it comes to nanny states.
Well, let's have a look at that one then. Those hard-pushed parents or those hard-pushed nursery staff won't be able to, at the end of a working week, go down the pub and have a pint and have a fag in the back garden, in the beer garden. If Keir Starmer gets his way...
Well, they'll still be able to have a pint, and this is part of what we as a government, in fact, building on what the last government did, to try to really get smoking out of our system, because 80,000 people every year die from smoking-related diseases. It's a tragedy for them, and it's an enormous pressure on the health service as well. So the ideas that we've brought forward, for example, in the tobacco and vaping bill, to over time make it illegal for people to start smoking, alongside the support that we provide for people to stop smoking, we think will make a massive difference to people's health and, in fact, to the pressure that smoking brings onto the NHS as well.
Yeah, and that's all fair enough, but what about personal freedoms in a free society?
Well, one of the things about, we had all of these arguments, I have to say, the last time I was in government, when we first introduced the smoking ban in public places, in pubs and restaurants, and people said, this is a nanny state, you're imposing on my freedom. Actually, of course, what we've seen is people have adapted to it really, really well. And it was probably one of the biggest changes that we were able to make to people's health and to the impact on the health service. I used to work in the health service, and people said to me the biggest thing that prevented people from having cancers and heart attacks was that smoking ban. There's more that we can do to help people to be healthy, and we're determined to do it.
But this isn't a ban on smoking, is it? It's a ban on smoking in outdoor areas, in pub gardens. We were talking to a leading doctor earlier on in the programme who said that in terms of our health, it actually will only have marginal benefits. So really, this is Sir Keir Starmer and the Labour government on a collision course with the hospitality industry, isn't it? It's our pubs. It's those great British institutions that are going to take the wrath of this.
They are great British institutions, and personally, as somebody who likes a pub, I'd rather go in it when there weren't people smoking in it, which of course was the argument we had last time. And when I want to sit outside, I quite like to be able to do it without a lot of smoking around me. Look, we will work with the hospitality industry in order to be able to make sure that we introduce this in a way that is sensible. But we are determined, as to be fair with the last government, that we make progress in reducing those 80,000 deaths every year from smoking-related diseases.